So I like to think of medications in 5 relevant categories. The first category that I think of is anti-inflammatories. These are very common to use in different types of injuries, but certainly can be broken down into steroids and non-steroidal anti-inflammatories like ibuprofen and other ones that we'll get into in that section. The second category I think about is muscle relaxants. Some people handle them a little bit better than others, but we'll talk about muscle relaxants in general and the role that it plays when people have spondylosis. Then we'll talk about nerve medications, and as you can imagine, that's more applicable when people have nerve dysfunction. There's different types of them, and we'll talk a little bit about that. We'll talk about opioids, and opioids can help somewhat, but not the most effective category of medications for spondylosis specifically, but that's a fourth category that we think of when we think about pain medications. And then there's this kind of last category that's not really well understood, and there's some medications like Tylenol famously, or acetaminophen, where it doesn't really fit into one of these other categories, but we'll talk about those types of medications as well.